Good afternoon, everyone, and thank you for taking the time to be here today. My name is Jason, and I'm with BionwoRx, Center for Functional and Regenerative Medicine in Carmel, Indiana. Today, I'm going to share information about a regenerative medicine wellness protocol called Photobiomodulation Plasma Therapy, or PPT, and how it's being explored as an option to support brain cell wellness. Before we begin, I want to clearly explain a few important things. This presentation is for educational purposes only. This therapy is investigational. It's not FDA approved to treat or cure Alzheimer's disease, dementia, or Parkinson's disease. It does not replace your neurologist or your primary care provider. And like any wellness protocol, responses may vary from person to person. We always encourage patients to continue all prescribed medical care. When we talk about Alzheimer's disease, dementia, and Parkinson's disease, we're talking about conditions that may affect memory, thinking, movement, mood, and independence. Research suggests these conditions may involve several underlying biological factors, including reduced cellular energy, changes in circulation, chronic inflammation, and increased cellular stress. While there is currently no cure, research continues to explore ways to support the health of brain cells. Our focus today is on supporting brain cell wellness. To understand this approach, it helps to understand neurons. Neurons are specialized brain cells. They transmit electrical signals, they support memory and cognition, they help regulate movement, and they influence mood and behavior. Brain cells require steady energy and healthy circulation to function properly. Unlike many other cells in the body, neurons do not easily regenerate once damaged. PPT is designed to support the environment around these cells, not replace them. Photobiomodulation plasma therapy combines two components: your own plasma, which is derived from your blood, and medical grade light therapy. The intention of combining these is to support cellular energy production, circulation, and balanced cellular signaling, which means that cells are communicating properly to maintain normal function and repair. Your plasma naturally contains a number of biological components, including very small embryonic like stem cells called VSELs, growth factors, platelets, cytokines, and extracellular vesicles, including exosomes. All of these components come from your own body. There's no donor tissue involved, nor are there any synthetic additives. V cells are very small stem like cells that are naturally present in your blood, and you've had them in your body since birth. They're sometimes described as embryonic like because, in laboratory studies, they resemble very early developmental cells. Research would also describe them as biologically young because they appear less aged under certain testing conditions. Early research suggests these cells may help support communication between cells and may respond to cellular stress signals, helping the body maintain tissue balance. In this protocol, they're used with the intention of supporting the cellular environment. Photobiomodulation, or PBM, is a form of light therapy. It uses specific wavelengths of red and near infrared light to gently stimulate cells. In our clinic, we use a medical grade Class 4 therapeutic laser system designed for controlled clinical application. Inside each of our cells are structures called mitochondria. These are responsible for producing energy. Research suggests that certain wavelengths of light may support cellular energy production, encourage healthy circulation, and support normal cellular signaling. Class 4 laser systems deliver high-powered light in a controlled manner and allow for deeper tissue penetration. They also help maintain balanced inflammatory responses. They're widely used in clinical settings for therapeutic applications. In this setting, the goal of PPT is to support cellular wellness. Your plasma naturally contains important biological components that help cells communicate with each other, support tissue health, and help maintain healthy circulation. Photobiomodulation uses therapeutic light to gently stimulate the energy centers inside the cells. This may help cells produce energy more efficiently, support circulation, and encourage healthy cellular signaling. When these two approaches are combined, the intention is to support healthy cell function, encourage cells to communicate and work together properly, and promote circulation and all the body's natural repair processes. Overall, this protocol is designed to support the body's natural biological processes. This protocol may be considered by individuals living with Alzheimer's disease, dementia, or Parkinson's disease. It may also be of interest to those who are looking for supportive wellness options that can be used alongside their existing medical care. And for many people, the goal is simply to support brain health and overall cellular function as they age. During the appointment, we begin with a small blood draw. Patients also receive a peptide IV therapy designed to support the body during the protocol. The plasma is then carefully prepared using clinical processing methods. Next, the plasma is reintroduced as part of the treatment protocol. After that, photobiomodulation therapy is applied using therapeutic light technology. The entire appointment typically takes about 60 minutes. After the initial procedure, patients typically return for photobiomodulation therapy once per week for 4 consecutive weeks. These sessions are intended to support cellular energy, encourage healthy circulation, and help maintain cellular balance. Some individuals may experience mild soreness or temporary fatigue after treatment, which usually resolves quickly. As with any wellness protocol, results can vary from person to person. As with any medical procedure, there are some possible risks. These can include bleeding, bruising, infection, or temporary soreness. It's also important to understand that some individuals may not experience noticeable improvement. All procedures are performed in a clinical setting by trained healthcare professionals to help ensure safety. This protocol is designed to complement, not replace, your existing medical care. We strongly encourage patients to continue working with their neurologist or their primary care provider and to continue taking any prescribed medications. Our goal is simply to provide an additional supportive wellness option alongside the care you are already receiving. Photobiomodulation plasma therapy is considered investigational, meaning it's still being studied and explored by researchers and clinicians. It is not FDA approved to diagnose, treat, cure, or prevent Alzheimer's disease, dementia, or Parkinson's disease. Instead, it's intended as a supportive approach focused on promoting cellular wellness. At BionwoRx, we focus on providing personalized care plans tailored to each individual's health needs. We utilize medical grade therapeutic technology along with a functional root cause approach to health and wellness. Our goal is to provide care in a supportive and compassionate clinical environment where patients feel comfortable and well cared for. Our clinic offers evidence informed, personalized therapies designed to support vitality, longevity, and overall wellness. By combining innovation, science, and a holistic approach to health, our goal is to help patients support balance, functions, and long term wellness. I'd also like to introduce you to our provider. Anna Marie Salyer is a board certified family nurse practitioner and co founder of BionwoRx. She has more than 10 years of experience in internal medicine, functional medicine, and regenerative medicine, and focuses on personalized root cause care using advanced diagnostics and regenerative therapies. She earned both her bachelor's and master's degrees in nursing from Indiana Wesleyan University, graduating magna cum laude. She also received a specialized training in functional and regenerative medicine and previously worked as a research coordinator at the Indiana University School of Medicine. Her goal is to provide compassionate, science informed care that supports each patient's individual health journey.